Nutrition and Health Promotion Part 2 lecture. The following 2 slides are the objectives we will cover in this PowerPoint presentation. First, we will talk about Choose MyPlate, which was introduced to the public in 2011. It now replaces the food pyramid. Its objective is to build healthy plates at meals. There are 5 basic food groups: fruit, vegetables, proteins, and grains. As you can tell, grains and vegetables are larger than the fruits and proteins. On the food pyramid, grains used to be the largest group. Now in the Choose My Plate option, vegetables is now slightly larger than our grains. Our dairy is the smallest portion, which 1 cup of milk does equal 2 ounces of processed cheese, so those who do not like to drink milk may substitute with our processed cheeses. The current recommendations are to eat a balanced calorie intake, eat more frequently is often suggested, and drink more water instead of sugary drinks that contain useless calories. Nutritional status assessment, body fat measurements. Fat is stored at the hips and abdomen. Excess may lead to or is linked to diabetes mellitus, especially type 2, hypertension, and coronary artery disease. There is a hip to waist ratio, which is measured with the calipers or DEXA scan, which is an X-ray that gives body fat distribution and bone density. Body mass index, or BMI, is a weight to height ratio and is figured out, it is measured in nanograms. BMI is calculated in weight in kilograms, which is divided by the height in millimeters squared. The risk of disease increases with the increase in waist circumference. So men who have a waist circumference over 40 inches and women who have a waist circumference over 35 inches are at significant risk of obtaining diseases. So here is a measuring body mass index scale. Death rates are significantly higher when BMI is over 25. So BMI that is 18.5 or less is considered underweight. 18.5 to 24.9 is considered normal. 25 to 29.9 is overweight. 30 to 39.9 is obese, and anything over 40 is considered extremely or morbidly obese. Therapeutic nutrition, modifying the diet, being consistent is very important. Calorie level, looking at the amount of calories in a food product, the amount of nutrients that the food carries, the degree of bulk or fiber. This is particularly important in our heart patients. Spiciness, and level of specific foods in the food product. There are types of diet. So a liquid diet, this would be a type of diet that we would give to someone who is going to be having a colonoscopy. We restrict the color of the foods that the patient can eat in the days leading up to the procedure. We generally say no red or purple colored foods. This can cause tissue to look like malignant tissue when the scope is being done. We generally instruct patients that they need to have a clear liquid diet, which includes water, clear juices, jello, and broth soups. Soft or light diets are no raw foods, no foods containing a strong flavor, or veggies that may cause gas. Mechanical soft is usually after an oral surgery. Some of the foods should be chopped, ground, or pureed before eating. Bland diets mean no spices or alcohol. Elimination, which is generally for patients with allergies, it eliminates 1 to 2 things. Say someone has an allergy to peanuts, we would eliminate that. High and low fiber diets are part of the plant and cannot be digested. The Cancer Society usually recommends a high fiber diet to decrease cancer rates, and it also helps in decreasing our blood cholesterol levels. Types of diets. Diabetic is based on the individual health needs. Basic goals of controlling blood glucose levels. Other factors may be considered. The best way to monitor is the carb intake. 1 gram of carbs on a 150-pound person increases the blood sugar by 4 points. On a 200-pound person, it would increase the blood sugar by 3 points. So a lot of times our diabetics are counting the amount of carbs that they are eating to calculate where they need their blood sugars to be. Heart healthy, reduce cholesterol levels and LDL and increase HDL levels. We also have the glycemic index, which is included in this, and that decreases the value longer. A decrease in value usually indicates that it takes longer for the blood sugar to increase in the patient's body. So if a patient with a low or a food low in glycemic index, that would take longer than for the blood glucose to spike than a food that is high in glycemic index. That would be a shorter period of time for that blood glucose to spike. Reading food labels. Very important, and a lot of Americans don't know how to read food labels. Valuable sources of information are included on our food labels. All food labels must include a serving size and calorie, the total of fat, which should be broken down into saturated, unsaturated, and trans fat, and the percent of daily values needs to be on the food labels. Some common food labels that we see in the grocery store, and a lot of us don't know what they exactly mean or have a false representation of what they mean. Light indicates that there are 1/3 fewer calories included in the product. Fresh means raw, never frozen or processed. Calorie-free means that there are less than 5 calories in the product per serving. Sugar-free means that there is less than 0.5 grams of sugar per serving. Fat-free indicates that there is less than 0.5 grams of fat per serving. Lean means that there is 10.5 grams of fat or less per serving. Low sodium indicates in a product that there is less than 140 milligrams of sodium per serving. Low calorie means that there is less than 40 calories per serving. Low fat means that there is less than 3 grams of fat per serving. And low cholesterol means that there is less than 20 milligrams of cholesterol per serving. Reading food labels. So nutrient amounts, weight per serving, and then percent of daily value. Ingredients are in descending order by weight. So the ingredients that are listed on the label first have are the most present in that product. The ones that are listed last are barely in the product but are worth mentioning. There is also a difference, especially recently. There's a big kick for organic foods. 100% organic really means that 95% of the product is organic in material. If the label says made with organic ingredients, that means that 70% of the product is made with organic material, 70% or more, I should say. And then anything less than 70% organic material cannot have the organic labeling on it. Nutritional facts label. So on top here you will see your serving size. It's very important to look at this. A lot of people think that a quarter of a carton of ice cream is 1 serving, when in reality it's probably 4 servings. So it's very important to look at that, because then if you're eating a quarter of the carton of ice cream, then you need to times your calories by 4. So that would be 1,000 calories here. So a lot of people don't do those calculations. They just think, oh, I ate a quarter carb of ice cream, it's 250 calories and it's 12 grams of fat. That is untrue. So it's very important to educate our patients on how to read labels. So look at the serving size and then how many servings are in the container about. How many servings should you get out of that carton of ice cream? Calories, usually this is the one thing that people will look at and are very aware of. However, usually it's the least effective in telling us what nutrients are available in the food itself. Total of fat, everything is always in grams, or cholesterol and sodium will be in milligrams. Over here on the right, you will have the percent of daily values based on a 2,000 calorie diet. Most people in the United States do not need 2,000 calories in their diet. A lot of people can sustain life and live off of 1,500 calories, mainly due to our increase in sedentary lifestyle. And then we have our carbohydrates, which are broken down into our dietary fiber, sugars, and then we have our proteins down here on the bottom. Some labels will have our vitamins and minerals that might be present. Some labels do not. This is not required. And then on the very bottom of the label, it tells us what we should have in our diet. And then usually below the nutritional facts here that we see, this little graph, there will be a list of ingredients, with the first ingredient being the most present in that food and the last one being the least present in that food. Organic Food Production Act, Producing and Labeling Regulations. We talked about a little bit earlier. I'm not going to go through them again. So in order for it to be organic, there needs to be no exposure to pesticides, chemical fertilizers, or sewage sludge. A lot of the farms that are producing these products have to have a barrier if the farm next to them is not an organic farm. A lot of times that barrier has to be 20 feet of trees or rocks. Foodborne diseases result from eating contaminated food or water, and we need to be aware of gastrointestinal type symptoms, which include fever greater than 101.5, diarrhea lasting 3 days or more, prolonged vomiting, blood in the stools, and signs of dehydration. A lot of times we need to be aware of these symptoms for screening phone calls. A lot of times we get phone calls due to these foodborne diseases. Some of the culprits as far as bacteria causing these are E. coli and Salmonella are the most common. In patients with Foodborne diseases will have a decrease in urination, vertigo, dry mouth, and altered skin turgor. Food contaminants, FDA warnings tell consumers of possible dangers, usually put on the news fairly quickly. Mercury, often seen in our fish products, especially in the Great Lakes area, and is becoming more and more popular even within our seafood. Cadmium, lead, especially with people who are drinking well water. This is very important. Here in central Wisconsin, we usually screen all patients or children at 12 months old that are drinking well water. PCBs are also common. And then another one not on this list, which is prevalent in central Wisconsin and northern Wisconsin, is nitrogen that can be in our water due to our plant sources. Our corn gives us high nitrogen levels in our soil and can get into our drinking water. Eating disorders, anorexia nervosa is self-starvation. Adolescents are sensitive to failure or criticism. Anorexia is considered when a person is 15 to 60% of their normal weight. Bulimia nervosa is cycles of binging and purging. And excessive exercise. A lot of times overweight adolescents who try and fail to lose weight will commit to these binging and purging cycles to try and lose the weight. Obesity is more than 20% of your recommended weight. Physician assessment, the BMI is greater than 30 when death rates increase. And we oftentimes look at that waist to hip ratio. Some cures to obesity or morbid obesity is gastrointestinal surgery or bariatric surgery. There are different types. Some of the criteria that insurance requires in order for this to happen is a BMI over 40 or a BMI over 35 with a diagnosis of diabetes or sleep apnea. Some of the types are restrictive, which decreases the size of the stomach, which slows the movement of food, makes you feel fuller longer. Malabsorption is the bypassing of the small intestines, so the food that you eat goes straight from the stomach to the large intestines. And restrictive malabsorption is both techniques combined. Some medications that patients can try outside of the bariatric surgery are phentermine, Meridia, or Orlistat, which is now Ali, which is over the counter. Health promotion. It's important to promote exercise. It improves the cardiorespiratory endurance, improves musculoskeletal health. It also helps if patients manage their stress. That fight or flight response can increase our fat absorption and storage in the adipose tissue. Health screening, it is important to encourage patients to have their annual physical exams and health history completed to help deal with these types and to help promote exercise and proper eating. Some of the things that we do in health screening are screen for cancers through our pap smears and PSAs, also our mammographies and colonoscopies. A lot of times we will also do other labs in our health screenings, such as a lipid profile to see where our cholesterol is at. Sometimes our electrolytes to make sure they're balanced, and our TSH to make sure that they are functioning properly. The role of the medical assistant: use charts and diagrams to illustrate diets. So the MyPlate is an excellent example. Consider patients' likes and dislikes. Remember culture and ethnic considerations. Can't tell a Hindu person to start eating beef. Encourage patients to take an active role in the process, and suggest local support. There's a lot of local support as far as curves or the local gym. A lot of high schools are opening up their weight rooms and gyms to the community, either for free or for a small fee. And that's a small price to pay instead of paying for treatment and management of diabetes further down the road. So convincing patients that maintaining proper nutrition and health up front is the way to go, and what we need to do as medical assistant.